So if somebody comes to you and they don't want dentures, they're currently wearing a denture or they're headed to dentures, you can't save their teeth, what are their options when it comes to dental implants?
Well, Randy, that's a great question. There's several options. First, you can go with as little as 2 implants and snap in, snap out lower teeth.
Okay.
And it's okay. It's not my favorite thing to do because there's still a lot of movement. Food still gets underneath it, but it'll hold it in place for the patient. A better option is to go with more implants. We like to make a bar on top of our implants and have that snap in, snap out.
What could they eat with that?
They can eat anything they want with that snap in, snap out on the bar, because what happens is the bar supports the denture, keeps it from moving. It only comes out when you take it out. Okay. But by far what people like the best are the teeth that don't come out at all. We put those teeth in, they don't come out, they're able to clean underneath those, take care of them, and then they're able to eat anything they want, and they don't have to worry about those teeth coming out.
So they could eat like literally broccoli or hard food, nuts?
Nuts, carrots, steak, you name it, whatever they want to eat, they can resume a normal diet.
Now what about the upper? Uppers are already good, right, for dentures?
Well, no, because most of those patients with uppers, although they have stability on some of these dentures, the palate's covered. And, that affects...
Oh, the roof of the mouth.
Absolutely, the roof of the mouth's covered. So that affects their taste, sour foods, different things like that. Some people, it gags. A lot of people, I tell them when they come in, they want a new denture. I said, I don't know if it's going to gag you or not. I don't have that crystal ball, So it's a guessing game. And, a lot of people really struggle with that gagging, but more importantly is they don't taste their food anymore. So again, we can make snap in, snap out dentures, or we can make the permanent dentures. With the permanent dentures, the teeth are permanently screwed in and there's no palatal coverage anymore. So you're able to maintain a beautiful, healthy smile, chew and eat anything that you want and not be worried about denture slipping again, denture sores, difficulties like that.
And you just brush them just like you would normal?
Brush them and floss them. Come back in and see our hygienist on a regular basis, just like normal teeth.
And everybody says, I wish I would have done this years ago?
I wish I had Nick for every time I heard that. They all say, why did I do this center? It's like, I don't know. Why didn't you do this center? Because it's such a great service for them. And it just changes their life. They're so much happier, so much more satisfied.
Is this the future of dentistry? Like maybe, whether it's 100 years, where the dentures as we know them today, just sitting on adhesive, that'll be gone. They'll all be attached to something. Is that your guess?
I think so. I mean, it's changed so much just in the last 20, 30 years that I've been involved in implant dentistry, and we're able to do so much more for our patients, so much more quickly, so much more effectively without a lot of discomfort. It's really been a fun and rewarding thing to be able to provide for our patients is a new smile.